Hi, I'm Dr. Terry Lanfear, and this is oms314, your Introduction to Clinical Oral Surgery. My expectations for you during your rotations over the next 2 semesters are to make you more comfortable, more confident, and definitely more competent with some oral surgery. Department objectives include making you more proficient with the surgical and anesthetic assessment of a patient, and then working that patient up through proper case presentation and review of medical history. Additionally, we want you to become comfortable with working in a sterile environment. This would include proper scrubbing, gloving, gowning of yourself, and then proper draping of a patient. Additionally, we want you to become familiar with the instruments we use in oral surgery and their various uses. We also want you to become competent at setting up a surgical tray. When it comes to local anesthesia, we'll probably introduce you to a few different blocks and refine your technique with administering nitrous oxide. Additionally, you'll be introduced to monitoring a patient on IV sedation. As far as the surgery, most of the surgeries you'll be involved with this semester are going to be exodontia, tooth removal, and we want you to become competent at removing interrupted tooth. With the impacted teeth, we'd like you to become competent at assessing the degree of difficulty and maybe making a plan of removal for that tooth. Next year we'll get into removing some impacted teeth. Additionally, you'll be introduced to some pre-prosthetic surgery. That would include alveoloplasty, maybe some soft tissue reduction, tuberosity reduction, and tora removals. Maybe later in the semester you'll also be introduced to some biopsies and probably assist on implant placement, and implant uncoverings. If you're going to be doing surgery, of course there'll be some complications, and we're going to work with you to properly diagnose and assess the seriousness of the post-op problem and how to treat some of the simpler ones. These would include localized osteitis such as dry socket, maybe a minor infection, some minor bleeding, maybe some complaints of pain and or swelling. If I haven't had the chance to meet you, I look forward to meeting you all and hope you enjoy the next 2 semesters.